Здравейте на всички! Ние сме в моята рубрика да поговорим за проблемното хранене и днешното издание за мен е изключително вълнуващо, тъй като мой гост е човек от програмата, по която се обучавам и се сертифицирам да терапевтирам. Тя е мой ментор и настоящ супервайзър, който всъщност следи цялата ми работа. Това е Кели Фитцпатрик. Тя е педиатричен логопед, SOS Approach терапевт и мой ментор. Работи деца от всякакви възрасти и сега ще издам няколко въпроса, за които тя и въобще целият екип на програмата се съгласиха да запишем това видео. Hi Kelly, thank you so much for joining us today with this video. Do you want to say something about you to the Bulgarian audience?
Yes, absolutely. Thanks, Valeria. My name is Keli Fittzpatrik. I am a speech language pathologist who specializes in feeding therapy. I'm currently located here in the United States, and Valeria and I have been working together as helping to develop more feeding therapy in Bulgaria, helping to further mentoring and supervision. So I'm happy to be here.
Thank you very much once again. So I continue with the questions. What can you say to the Bulgarian parents as advice while starting solid?
Great question. So when starting solids, one of the things that you kind of want to look at first is your baby ready to start solid foods? There are many different factors that you want to make sure that your baby is able to do before you start solid foods. So one of them is, are they able to hold their head up while they're sitting? That is a way that kind of tells you, okay, they might be ready to start solid foods. You also want to think about just having this be a fun learning experience. You want your face to be happy, your voice to be happy. You really want to role model teaching some of those movements that the baby should be doing. Nom, 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 with a big smile on your face. You really want these early solid foods to be fun, for exploration, for playing with the food, and they're probably not going to eat a huge amount of food at the start because they're just learning and it takes time. A lot of it might be spit back out at you, and that's okay. You still want to smile, be happy. I always like to tell parents, like, you're the teacher, the child's the student, and you're kind of helping them learn and teach them how these movements. So you really want to focus on the pleasure of the experience, not necessarily the volume at the start, and thinking about what to serve them as well too. Sometimes if you're worried if your baby has allergies, you might want to just do one food at a time to kind of test to see, do you see any allergic reactions? I sometimes say kind of going slower, introducing some of those flavors can be a little bit better. But then also I think allowing them to be messy, putting it on their tray, letting them touch it, letting them explore it. That's really how babies at this age learn about food.
Okay, thank you very much. A lot of toddlers during the phase of lean refuse solids. And it is very common for parents to hear, wait, he or she will outgrow it. Why this is not a good advice?
Yeah. So as a feeding therapist, I get this question asked all of the time as well too. And the tricky part is that the research tells us that a lot of kids do outgrow picky eating at some point in their life. About 50% of parents are saying their toddlers, so like 2-year-olds, are picky, but about half of those kids are outgrowing it. The other half actually do not outgrow it. And so the tough part is kind of figuring out which kids will grow out of it and which kids won't grow out of it. In our clinic, we have created a few different handouts for parents to help them figure out if their child is going through a stage, one of these stages, or if it's like more of a skill kind of deficit issue. Some of the things that you want to look at, and Valeria, hopefully you can link this into your YouTube notes as well too, this handout, is some of those red flags. So does your child have poor weight gain? Are they frequently choking, gagging, coughing during meals? Those are all signs of like, they probably need a little bit of help maybe. If a child is avoiding like all like a certain texture or certain nutritional group. So if they're avoiding proteins, for example, if they're not eating any pureed foods, that can be a sign of like, hey, we might need a little bit of extra help. If they don't have many foods that they're eating, like if they're eating less than 20 foods, that might be a sign of like when they might not outgrow it. We might need a little bit more support. And then I always say if mealtimes are a battle, if mealtimes are a struggle, if you're having a hard time feeding your kid, this can be a red flag of they might have a hard time growing out of this issue. We do have a handout that kind of differentiates between picky eaters versus problem feeders. And so Valeria will link that into her notes as well too, for you as a parent or as a therapist to kind of go through and be like, is this just a phase, or is this something that your child does need a little bit more assistance with? I always like to say, if you have any concerns about their eating, it's worth reaching out, because feeding therapists can definitely provide some help to your child.
Thank you very much. I'll definitely link this in the comment box. And I have another question. Is food play a key part of child development and having a good relationship with food? A lot of parents are raised with the thinking that it is not appropriate to play with food. Can a child never stop actually playing with food? Why it is not wrong to do it? And when the manners at the table can come?
Yeah. So I always say wearing your food and getting messy is part of typical normal development. This is part of the process of learning how to eat. And we can learn a great deal about the food even before it goes into your mouth. I always call this the black cave. And learning and playing and touching your food can give you so much information about that food before it goes into your mouth. Our skin is covered in hundreds of thousands of touch receptors, which helps us know what the food is going to do in our mouth. And so we really want to play with a purpose, also known as getting messy, to help teach the child the physics of the food so it's not a surprise once it gets into their mouth. A lot of the times when you touch the food, it helps prevent those surprises of tasting a new food. Allowing your child to get messy, to explore the food before tasting it, also gives them something else to do besides just throwing it on the floor or crying and screaming if they're not ready for it, or just simply leaving it on the table. It gives them some options of things to kind of learn and explore with the food. I always kind of say, like, helping to teach the child how to eat comes first, manners come second. I would much rather my child be learning how to eat broccoli or learning how to eat carrots rather than saying, I need carrots, please. And so manners will come into line after that. Also, if we're kind of using too many manners, like, you have to say please, you have to say thank you, don't throw your food, don't play with your food, that kind of thing. Sometimes that can get in the way of playing and learning about food. And so we want it to be a positive mealtime experience. Of course, there's always the occasions when you go to a restaurant or you go to grandma's house and you have to kind of mind your manners, which maybe as a parent, you might prep your own child of just saying like, hey, we're going to grandma's house. We have to mind our manners today. So being messy is a very important part of learning how to eat.
Okay, yes. Thank you very much. And one last question. Feeding therapy is not popular in Bulgaria. And as SOS approach to feeding therapy, how would you describe it to the Bulgarian parents?
Great question. So The goal of the SOS approach to feeding is really to help a child develop a healthy, lifelong relationship with food. We want meal times to be fun. We want them to be enjoyable. We want a child to come up to the table and actually want to eat, right? We don't want it to be a chore. We don't want it to be like a battle, because we eat a lot of times a day. We don't just eat once a day. We don't just eat 3 times a day. We're actually eating 4 to 6 times a day. And so if we're coming up to the table every single time and eating is hard, this can be tough. And so we really want to change a child's focus on how can I have a healthy, lifelong relationship with food. The SOS approach to feeding treats the whole child. So it's taking into account not only like their sensory system, but also their oral motor muscle systems, their big body muscle systems, their organs, their learning, and their cognition, their development, their nutrition, the environment. It takes a whole child approach, and it's looking at all of those different areas. We really, in feeding therapy, want to help focus a child's like increasing their comfort level by exploring and playing with different properties of food. The program allows a child to interact with foods in a playful way, a non-stressful way, and just by simply beginning with the ability of tolerating the food in the room. Because we all know those children that as soon as you bring out an apple, for example, they're out of there. And so we have to start with like, okay, is the food okay with even being in the room with you? And then moving on to maybe managing the smell of the food, learning about how the food feels on your body and in your mouth. And then on to kind of enjoying tasting and eating the new foods following the steps to eating. So we know learning about foods does not begin at your mouth. There's a lot of different steps earlier on that we need to do before we're ready to kind of practice the chewing and swallowing.
Thank you very much for being here and for your time. And see you soon. Bye bye.
Thank you so much. Bye bye.